Welcome back to the channel. Today we're talking about a critical issue for rural communities. Senator Josh Hawley is urging Congress to act now to protect rural hospitals from cyber attacks. These hospitals are lifelines, but they're vulnerable. The risks are real, and the consequences could be life-threatening. Senator Hawley highlighted a critical issue. Rural hospitals are under siege from sophisticated cyber attacks. He asked Mr. Garcia what we should learn from attacks like the Vault Typhoon hack. Garcia warned, these attacks come from nation-states and elite criminals. Small hospitals have no cyber defense budget, no IT staff, and no armor.
Thank you, Mr. Chairman. Thanks to the witnesses for being here. Mr. Garcia, if I could just start with you, I want to talk a little bit about the challenges that rural hospitals in particular face from cyber attacks, malicious actors. What do you think, thinking about the Volt Typhoon attack of this last year and a half, what do you think are the most important lessons that we ought to draw from that attack, and particularly if you could apply this to rural hospitals and the challenges that they face?
Well, thank you, Senator. Certainly there are very sophisticated attacks out there from nation states and other sophisticated criminal groups that are beyond the capacity of rural, small, critical access health systems to counter, even the larger health systems. We cannot beat nation states.
Garcia shared insights from a new report based on interviews with over 40 healthcare executives. We know what to do, we just don't have the workforce or money to do it. These frontline hospitals are begging for help. Some are the only providers for hundreds of miles. They need boots on the ground and dollars in the budget. That's not a want, it's a need. Senator Hawley didn't just raise the alarm, he offered solutions. He asked what Congress can do now to support vulnerable hospitals. The answer? Financial support, cybersecurity compliance, and National Guard help. Think of it as a cyber 911 for your hospital and care.
We did a publication in May called On the Edge. We interviewed 40 executives across 30 states, not just rural, but critical access, FQHC, small practices, asking them, what are your concerns about cybersecurity? How are you prepared to deal with it? And what would you need from the government or from your community to support you on that? And the results were not surprising. They said, we know what to do. We don't have, as Ms. Stevenson said, we don't have the capacity in workforce to deal with this. We don't necessarily need training. We need people. Bring the people in, and we need some support, whether it's financial incentives to invest in better cybersecurity or direct financial support. So there's a lot of, I commend the report to you. There's a lot of recommendations in there for both us in the industry and for the government.
Ms. Stevenson, do you want to add anything to this?
I think that was a great summary. Thank you.
More than 40% of the hospitals in Missouri, my state, are rural hospitals, and about half of those are critical access hospitals. And I just want to underscore something you said, Mr. Garcia, that many of these hospitals have faced some level of cyber attack, and they simply don't have the personnel or the budget to deal with it. They don't have a cybersecurity officer on staff. They don't have the budget to work on turning back cyber attacks. What should Congress be doing to help rural hospitals in particular be able to meet the challenge of malicious cyber actors and the threats that this poses to patients, that it poses to hospital staff, that it poses to the working of the hospital? I mean, what can we be doing to help rural hospitals? I'll start with you, Mr. Garcia, and then anybody on the panel who wants to respond is welcome to.
Well, certainly we've talked about better incentives. When you think about CMS, can they tie some level of reimbursement to better cybersecurity practices? You're doing the right thing. You're implementing the health industry cyber practices that we produced, or the NIST framework. We're going to give you a little bit of a bump on your reimbursement. That's real money. Senator Husted talked about National Guards at the state level, those who can help in what we call a 911 cyber civil defense. How can we rally the community around your rural hospitals who do have the expertise? It's a lower cost option, but where the government can be using its reimbursement authority as leverage, that can be helpful.
Very good. Anybody else want to add to this? Yes, sir, Mr. Weissman.
There's another side to this story. While rural hospitals struggle, big corporations stay silent. These tech firms have resources, but many don't invest in defense. Some even try to avoid liability. They must be held responsible, no free passes. When they fail, rural America suffers. Senator Hawley introduced the bipartisan Rural Hospital Cybersecurity Enhancement Act. It's overdue. The bill directs HHS to create a cybersecurity strategy for rural hospitals, including workforce and funding. These hospitals are the lifeblood of our communities. We must do more.
Well, 2 points. One, unfortunately, I'm afraid that the reconciliation costing rural hospitals Medicaid funding is going to make some of these challenges harder. But two, I wanted, in building on work that you've done, and Mr. Garcia talked about Change Healthcare as a utility, because we have so much concentration in the industry. It is true that rural hospitals are just overwhelmed, but the large companies are not, and they are not investing enough. And there is, I think, a need to impose extra obligations on them, new standards, and absolutely to maintain their liability. I disagree with the suggestions to remove liability. The way they're going to be held accountable if we don't have adequate regulatory standards is through lawsuits that make them pay retrospectively. Better if we could stop it in the first place.
I've introduced a bipartisan bill called the Rural Hospital Cybersecurity Enhancement Act. It does some of the things that you were just talking about, Mr. Garcia. It starts at just a very baseline level, directing HHS to develop a comprehensive cybersecurity strategy for rural hospitals, to look at workforce needs, to look at funding needs. I think this is long past due, and again, I can just tell you, coming from a state where 40% of our hospitals are rural. I grew up in a rural area. I live in a rural area now. I grew up in a rural area. Those hospitals are often the lifeblood of those communities, and they literally save people's lives. And we've got to do more than we are doing now to protect those hospitals, number one, in all of their operations, but also number two, in helping them from this cybersecurity threat, because they're simply not equipped to deal with it. And realistically, they're not going to be, absent some assistance from the federal government. They do not have the wherewithal on their own. So we've got to do more. I hope that we'll be able to mark up this bill soon in this committee and take it to the floor as a place to start. Thank you all for your testimony, and thank you, Mr. Chairman.
Now it's up to Congress. Will they act or wait for the next attack where help is already scarce? You can help. Share this video, spread the word, and demand action for rural hospitals. Click subscribe and join us as we uncover more that matters. Stay safe, stay informed.